All right. Hello, you brilliant, bright, and beautiful minds. Welcome to the first episode of the Journey to Medicine podcast. My name is Caleb Van Orden, and this is a podcast where essentially we break down a multitude of different career paths one can take in the field of medicine by interviewing guests in said fields. Today, we are honored to have Hannah Johnson with us. Could you please, Miss Johnson, introduce yourself to the audience?
Hi, yes, my name is Hannah Johnson. I am in radiology. I have been a radiological technologist for nearly 10 years now. Currently, I am an associate manager in my field.
Awesome. So yeah, obviously today for the first episode, it's going to be on Radiologic Technologist. And so I guess let's just start off with the questions for everyone. First question I'm going to ask is what exactly does a radiologic technologist do in a very broad sense? And then what's your scope of practice as it relates to medicine?
So in a broad sense, we take pictures, typically of everything in your body, to be honest. One of the things that I love about the field is that there's so many different facets. The baseline of a Rad Tech, as most people call them, is flat plate pictures or one-dimensional pictures or two-dimensional, if you will. So you're just seeing one view. Most of our imaging that we do in that field is going to be two views, and it's called diagnostic radiology. We're looking at broken bones. We're looking to see for foreign body objects, that kind of thing. Then as you move into other modalities like CT, MRI, ultrasound, nuclear medicine, you start to get more in depth into tissue, brain tissue, functions of anatomy, that kind of thing. Does that answer your question?
That does answer the question. Now, as far as it relates to radiologic technologists, for those interested in joining this field, what kind of education or certification is required? And what would your education background be on the path? There's multiple.
So first you would start out with, for a radiologic technologist, you'd start out with a 2-year degree. So typically that can be accomplished at with an associate's, through a community college, through other programs. Some hospitals out there still have programs that offer this type of education that you do end with an associate's of science. Most people attend a community college or a 4-year college even. There are 4-year degrees for a radiologic technologist that is not an associate, that is a bachelor's degree of science. So there's lots of different ways you can go with it, depending on which field that you're going into. Once you obtain your associate in radiologic sciences, then you can move into other modalities through different means as well. So say, for example, CT, which is near and dear to my heart, that's where I went after diagnostic. You can train on the job, or you can go through another program. Most of our students go through other programs because it's a competitive field to get into. And if you're waiting for someone to cross train you into the field, then it's going to take quite a while. I was one of the lucky ones, and part of my job, I was trained immediately in that field. So you still do have to take your board test. So you are a registered technologist in all the fields. So I am registered with a national ARRT for both my diagnostic and my computed tomography.
And so you kind of mentioned different modalities, different types within the field of radiologic technologist. I just want to ask, do you have to get certified in those specific fields when you're talking about cross-training for ultrasound, MRI, stuff like that, CT? That's all independently on top of your associates or BSN?
Correct. Yes. Now, some of those are a little different. So back in the day when I was going through my schooling and picking my career, you had to have a Rad Tech for your base before you could get into CT, before you could go into CT, MRI, ultrasound, that kind of thing, nuclear medicine, all of that. So now things are a little different. You can go into ultrasound straight away. You don't have to go through a radiology program. But that, in my opinion, limits you to a degree because you do not have a background in radiology. Nuclear medicine is another field that I think you can go straight into, or PET CT is kind of in that area, but then you do have to have a radiation background. We cross-train a lot of nuclear medicine technologists into CT. Unfortunately, it's kind of a dying field, and it shouldn't be. It's actually pretty fascinating, and there's a lot of things that can be done with it. But typically in that field, you need a radiologist to champion it with whatever facility or hospital that you're with. If you can find someone that's passionate about it and that can help people see the scope of that practice and the benefits of it, then that facility will typically have a pretty good nuclear medicine program. Otherwise, a lot of physicians fall back on CT or MRI in place of the nuclear medicine.
And is the reason why fields like nuclear medicine are less devoted to is because they're having other different types of technologists take over that type of, and it's crossing over, so it's kind
yes and no. Yes and no. Really what it is those are very expensive exams. So whatever you're talking in the world of medicine, it's always going to be about money with your doctors, with your facilities, your hospitals, all of them. So if you can get an exam with the same information through a CT versus nuclear medicine, that's going to be a lot more affordable and cost effective for the insurance company, which also means it's more affordable and cost effective for the patient. However, there are still some things that cannot be substituted through nuclear medicine as far as best images possible. So when you're looking for different types of cancers or treatments that are specifically designed around using nuclear medicine, they really haven't replaced all of that quite yet. And again, like I said, nor should they. It's really a phenomenal field that's kind of losing its light, if you will, because of money and because of needing those doctors to champion it. Another reason is nuclear medicine tests typically take a long time. You can get a CAT scan of a chest. For example, one of our biggest comparable exams between the two would be a PE study, which is a pulmonary embolism. It's been in the news a lot in the last couple of years because of COVID, that you get a blood clot in your lungs. So if we have someone that is allergic to contrast severely, we can't pre-treat them before a CT scan, which takes about 2.5 minutes total, and we can have results and know immediately if they have a blood clot. Then the alternative to that is a VQ scan with nuclear medicine. That is not a 2-minute test. So, and it's a lot more expensive. So that's why.
Interesting. Yeah, there's something to take account to the price when it comes to medicine as well. It's just the reality of life and everything we go with. So you've talked a lot about your background and everything, but I want to ask, why did you pursue this specific career in medicine? Like, what made you choose radiologic technologist over other fields?
Like say nursing or something else.
Yeah, well, nursing or,
there you go. Honestly, it was a couple different reasons. So when I decided to go pursue my career in radiologic technology, I was looking for something. I was a single mother. I had 5 kids at home. I was looking for something that I could do that would, one, be fulfilling and I would enjoy and love, and two, be the most bang for my buck, if you will, for the amount of time that I was putting into it. So a 4-year degree versus a 2-year degree, I'm making money for my kids. I will tell you this. I've talked to several student groups actually, and kind of shared my journey and my story, and told them all of the many reasons why I love this field. I love this field because of patient care. I am a nurturer. I'm an empath. I'm someone that wants to take care of people. And I really enjoy working with others in the medicine field. An associate's degree is a lot less time and a lot less money than a 4-year degree. That is not to discount the 4-year degrees at all. But I am someone that is living proof that you can be successful in a career with a 2-year degree and be very good at what you do, enjoy what you do, make 6 figures, provide for your family, hone in on your craft, if you will. All of those things that you hear, all those phrases you hear people throw out. But I had friends that were in the field, and I asked people, do you love what you do? What do you do? Explain it to me. What really sparked my very first idea of going into radiology was when I was pregnant with my triplets. So I had to go in and get an ultrasound every 2 weeks for the entirety of my pregnancy. And I fell in love with it. It was fascinating to me. I loved it. I loved the information you could gather from such a simple, non-invasive exam. And years later, when I was looking at it, like I mentioned before, when I first started into this career, you had to have a background. You had to have your associate of radiology of sciences before you could go into any of the other fields. Now you can go straight into ultrasound. But at the time, that was my first step to get into ultrasound school. Ironically, I did apply to ultrasound school after I received my radiologic technologist associates in sciences. And then I changed my mind. Life takes you in different directions. I moved and continued to pursue in the field with X-ray and CT, and I absolutely love it. So I feel like this is a field where you can't go wrong. There's something for everyone.
Yeah, and you're talking about there's so many different avenues you can take as a radiology technologist. Do you see, as somebody who's been in it now for 10 years, as you say, or more, is there any advancements or continuing education or any progress the field will have in the future that you see coming in the
Oh,
field?
absolutely.
Yeah.
Absolutely. So there's always areas to train in. So for example, I'll give you, first I was a Rad Tech, then I was a CT Tech.
Mhm.
Within CT, there's so many things you can do. So you can focus on cardiology. You can go to, well, even without CT, you can go to the cath lab. You can
Mhm.
be a rad tech that works in the cath lab. There's something called interventional radiology, which a lot of people are not familiar with. But that is a huge aspect of our field. And that's straight out as a rad tech as well. You can be a registered, you can take your board exams for an IR tech, but most facilities don't require that, as it's a year-long training after you are established in your career as a rad tech first with some experience. But those are really, really interesting. Those are exams where we are truly saving lives. We are stopping bleeds. We are grabbing blood clots for strokes, all kinds of things, chest tubes, biopsies for cancer, all those things. But having been in there for 10 years, the field is always changing. And there is a lot of people out there that are encouraging us to finish with our 4-year degree, bachelor's of radiology. And the interesting reason is not so much because it's going to help us in the field that we're in or help us in our current job, but more to bring professional recognition to exactly what we're doing into our field. Nurses are in the same boat that we're in. So you can have an associate, you can have your RN, take your NCLEX and be a registered nurse with a 2-year Associate of Science degree in nursing. But a lot of them are being pushed to get their BSN, their bachelor's in nursing, which is a path that my daughter is currently on. But you don't have to do that. It's more of a, I'm not sure what I'm trying to look for. It's more of the way of where the field is going, and also kind of a way to differentiate yourself. In my opinion, and I think most in our field would agree with this, moving on with your education from that associate, which truly is what you're doing your job in, is more for management and to continue on in your role. So I'm in that boat right now. I am a manager in our radiology field who is moving up and growing in the healthcare industry and looking towards that bachelor's of health sciences, and then potentially a master's in healthcare. So, but that is really more for supporting those departments, not really anything to do with my ability to be an amazing radiologic technologist and take care of you as a patient if you come in on my table as a trauma. Does that make sense?
100%. Yeah. And it's very good to know that kind of thing, especially for when viewing different types of medical careers you could take, knowing
Yeah.
that especially for non-traditional, such as yourself being a mother and everything, that there are options to take for just an associate's, or for even those that don't want to do a 4-year degree, and you can always progress later. And that is not a necessity to be effective in your career field. So that's very important to know for those interested in possibly being a radiology technologist.
Yeah, I really think that moving forward in life, skilled labor, which really every job is considered a skilled labor job in my opinion, but skilled labor, I think is really should move toward more focus on your actual field and career. How much of our education is fluff and just there for the well-roundedness sake, as they say, and how much of it is truly dedicated toward what we're focused on. I can assure you most of the education I got was pertinent to my job within those 2 years. And even in those 2 years, there were some that probably was a little fluffy as well, to meet the requirements of an associate's degree. But for the most part, it was very focused, hyper focused on what I was going to actually need to know in order to perform my job. I think that's something that moving forward in life, those skilled labor jobs, if you will, or trade schools, tech schools, that kind of thing, really, in my opinion, is where it's at.
Yeah, it's great to know, and something you need to take into account when considering what to do, and it's just a reality. As far as, if you're okay, I don't know if you're allowed to, but could you talk about where you currently work, what hospital, and the clinical setting of that and your role?
Well, because I am not a spokesperson for the hospital, I cannot actually mention that. But I can tell you about my role within that hospital. So I do work at a very prominent level 1 trauma center in the Arizona Valley. It's an amazing facility. We have a very high acute level of patients. One of our sister sites is a comprehensive stroke center. We are working toward that as well. That means that we see a lot of stroke patients, and that means they come to radiology.
Yeah, get the scans. So you talked about the benefits of why you want to join the field and everything. Is there anything you wish you would have known going into the field as you like did all the training, everything you wish you would have done it now that you're 10 years into the field? Or is there anything that you didn't think about the job as a reality that 10 years into it, you're like, wow, I never thought about this when I was doing my education to be a radiologic technologist?
That's a really good question. Usually the thing that I say the most is I wish I had done it sooner. So I wish I had straight out of school realized the benefits of picking a career, picking a skill versus waiting until I was a single mom with 5 kids. That'd probably be my number one. Don't waste your time either with education that you're just filling in classes so that you're going, right? Typically those 4-year degrees, the first 2 years they say is just general ed, which is classes everybody has to take regardless of their degree. Which kind of goes to my point of really what's the benefit of those classes? They're not really focused on what you're going to be doing other than life skills, speech, being able to handle yourself in a professional environment, all the things. You're learning definitely plenty of skills in those areas, but also a lot of fluff that you probably don't need. I would have done it sooner. Something I didn't anticipate when I went into the role. Healthcare is very political, and I don't think people realize that. It's more political than I would have realized. I think in any work environment, there's going to be politics played on a management level. That's just life. But really frustrating to see patient care dictated by money, insurance companies versus what they really need. And we really see people at their worst. We see people at the end of life of cancer. We see them after really horrific, traumatic events, accidents, boating accidents, car accidents, suicides. I am surprised at the number of suicides that I see. I'm not sure why that didn't occur to me in the health field. Obviously, it's part of it, but I am very shocked, especially in the last couple of years. We have seen an incredible difference in that. And I really think what that does is it brings to light where all of the holes are in healthcare in general. I am part of the puzzle. Radiology is part of the puzzle, but you have patient onus on their own health, right? So live a healthy lifestyle, do all that you can for yourself. Then there is provider onus, making sure that they're actually taking good patient history so they know why is this happening, what's the best treatment course for you. And then you add in the farm companies and insurance companies who, instead of doing what is right for the patient, they dictate what is allowed for the patient. That is something I really wasn't prepared for. And hearing these people's stories, you really get to know your patients.
Definitely. Just kind of the frustrations of the medical field, I guess, sometimes. As far as this is kind of in the same vein, pros and cons of the job in your opinion, for anyone that'd be interested in it. You did mention that kind of a little bit as something you didn't expect and the frustrations that can be associated with that. But are any, what are the number one pros of your job, and what's something that, every job has their downsides. What's the downside?
Yeah. I love meeting people. I love patient cares. I love all the different walks of life. From the crazies to the, mamas to the babies, to the kids who are coming in trying to figure out why at 20 years old their hair's falling out, right? I love people. I love to take care of people. I don't love that, but I love that I can help find a reason. There's lots of memes out in our field that say, I'm the first to know what's wrong with you. I really enjoy pathology. I like to see, this is why you've been suffering. This is why your stomach hurts. This is why this is happening. I'm fascinated with the human body and the way things work. I'm also a little bit of a squirrel person, an ADHD person, I like to say. And our field is a fast-paced field. You're not sitting around very often. Sort of, to a degree. So in radiology and CT, it's that way. But in, like, say, nuke med or MRI, they're going to take their time more, depending on what you're doing. If you're a Rad Tech straight out and you're in diagnostic radiology, you might see 70 patients a day. In CT, we might see 25 to 50 patients a day per person. I might have contact with that many people, in a 10 to 12-hour shift. Nuke med, they're probably going to see 6 to 12 patients a day. MRI, they're probably going to see close to the same, maybe pushing 10 to 15, depending on what types their exams are. So specifically in the fields that I've worked in diagnostic and CT, I really enjoy that in a hospital setting and in the level 1 trauma center. I'm never bored.
And that's something important to take forward. Like, there's so much variability in the work style
Yes.
that people can find what's suited for them in this field. That's good to know. So next question I'm going to be asking you is, what other medical professionals do you interact with in your day-to-day responsibilities outside of radiologic technology? Because that's just reality, especially working in the hospital setting.
Yes.
Who are the individuals you're working with, and what is that dynamic like for a radiology technologist?
Well, me specifically, so being in management, I'm touching every aspect of the hospital. If you take it down to a technologist level in the room, actually scanning, taking care of patients, taking pictures, they're going to touch trauma docs, nurses, general specialists for inpatients, specialists outside when we're doing outpatients. So we're going to touch cardiology. We're going to touch, cancer, doctors that specialize in all of those areas. Goodness, dermatologists even, because, we take pictures for skin cancer, melanoma, women's health for mammography. Mammography, that's what I forgot to mention. That's part of radiology as well. Goodness, there's so many different areas. I can't think of a single ancillary in the hospital that I don't deal with on a daily to weekly basis as a technologist, and especially as a manager. There's so much collaboration that has to go into, patient care. For example, we're doing a lot of work right now with our cath lab TAVR programs. A TAVR is a device that is placed in the heart when there's issues going on. That's a very broad overview of what that is, just so you know, but for the sake of time. But in that, we're talking to IT people because of the software programs that we're using to upload our images into other programs that are going to be taking measurements and actually designing and creating the device to specifically fit each individual patient. It's not a plug and play device. It's not like you can say, I need an extra large or a small. It literally creates the specifically for that patient. So I've had several meetings in the last couple months with our IT department, our computer people, our infrastructure people, to help us figure out how can we get this program to talk to this program, and that kind of thing. Something you probably wouldn't have realized, taking care of patients, you were also going to have to deal with informatics and computers.
Yeah, I honestly, that kind of just makes sense 100%, because practicing medicine in itself is and should be a team effort. So that's just really interacting with everyone. Kind of going back to another previous question, when we were talking about like different careers and pros and cons, what is the work-life balance like in your career? And since there's so much variability, I would assume there's also a lot of variability in the work-life balance you can have as a radiologic technologist.
100%. So it really depends on which area you go into. For example, if you are working in an outpatient imaging facility, you're looking at what we call banker's hours. Typically Monday through Saturday, not many of them are open Sundays. Some are. Most of those are going to be like an 8-hour shift. So you're pretty much, for the most part, looking at like a 5 days a week, 8-hour shift, whether that be Monday through Friday or, Sunday through Thursday or Tuesday through Saturday, whatever that looks like. In a hospital setting, you have a lot more options. One of the things that really appealed to me about this job that I failed to mention before when I was looking for careers was work-life balance. How can I support my family, but also be with them more with my job? Well, Condensed work week is a huge seller in the hospital life. So most hospitals, for your shifts, you're looking at 312s, 410s for all of the positions. Now, radiology is a little different because we're supporting so many areas. We have inpatients, outpatients, ORs. We're in the surgeries with you, taking pictures while the doctors are performing surgery on you for just about everything. So those get a little different. You can have everything. We've got 5/8s, we've got 410s, we've got 312s, we have 4/9s. It just depends on the needs of your facility and your hospital. Most of my departments have been set up with 410s or 312s, with a couple 510s sprinkled in there. So the work-life balance is actually pretty nice. It's really going to vary facility to facility, but call is always a thing with the medical field, right? So you've always got these call shifts where I might be a 312, but I've got 2 call shifts a month, or I've got 5 call shifts a month. It just depends on the area. Interventional radiology, that's one thing to really take into consideration. If you're a technologist that's really interested in IR, something that comes along with that is a lot of call. And that's usually, honestly, a make or break for people when they're looking into the field. It's fascinating. They love it. They want to get into it. But you're talking a significant amount of call because you're saving lives. We're coming in, not that everybody isn't, but strokes, there's time. We can't wait. We can't say, okay, tomorrow morning we'll get this clot out of your brain, or we'll cold that bleed that you have going on. That's not going to save this patient's life. So you need to be there when they need you. So depending on which field you're working in the medical field, even within radiology, call is another thing. But I would say, for the most part, I like the hospital setting for that very reason. I feel like you do get more of a work-life balance, and it matters who you work for as if they are supportive of that. So
definitely. Now we kind of touched on this branch a little bit, but when I talked about like the advancements in the career itself, do you see any changes or advancements in the education requirements, or either education requirements or changes in the scope of practice of what you can do? Mainly because you were talking about the associate's degree. Like, do you see a need where, you're talking about bachelor's isn't necessarily necessary? Or do you see a lot more associates to bachelor programs because they're trying to push that to validate the field and everything like that, or et cetera?
Yeah, actually 100%. As a manager, I've been receiving a lot of emails and information and phone calls from local colleges and even colleges out of state. One of them that we've started working with out of state is Weber State out of Utah. They've been sending us students, and they have a associates to bachelor's program. Several colleges here in Arizona do. There are actually online programs all over that you can get into for an associates to bachelor's in either a generic associates to bachelor's of just sciences, right? Mm-hmm. Or radiologic sciences. So you can actually do both. Mm-hmm. There has been a significant push here in the last probably several years, to be honest, pushing them to continue that career. But really, for the most part, the reasons are 2 reasons. Either one, for more professional recognition within the field for what we actually do, and 2, management and advancement within the healthcare industry. So I personally feel that unless you're trying to advance your career into management.
Oh, 1 second. We're having some audio issues at the moment. Can you hear me? You can hear you. It's going to be on my end. I am so sorry. You just cut out, and I do not know why.
We reached our time limit.
There we go. It's my internet connection. It's saying I'm the unstable one. How dare I? I think we're okay now, though. I think we'll survive. But there was a little break.
Where'd you lose me?
I had left you were talking about essentially where, unless you want to go into management.
Yeah. I really feel that unless you're trying to advance your career in the healthcare industry, a bachelor's degree is really it's just not beneficial in my opinion. It can make a difference in your starting pay. It's one of the things that we look into as far as all of the different areas when we're making offers and jobs to people is what their education level is. And it does help a little bit in that area, but I still don't see it being enough to justify the financial cost or time of those additional 2 years in school. And really, if you're working and doing those 2, then where's your work-life balance? Because you're taking time away from your personal life, when you're not at work, to try and advance to this bachelor's degree for what? Again, it could be beneficial depending on what you're trying to do.
And that's important to take, especially like very important words to take as you are a supervisor and help with hiring radiologic technologists, etc. So if that's the reality of the career, the best person into that would be you. So especially for people who want to pursue this, they need to understand what is and isn't important for what they want to do. And if they want to go management, like you've been talking about, they might want to do the bachelor's route or etc. or do a associate's to bachelor. But it's important to take that into account. Like this is what hospitals and individuals are hiring and what they want for qualification.
Yeah. Regardless of whether we agree with it or not, that is the reality. Yeah.
It's the reality. Now, again, this podcast is for individuals who are interested in a multitude of different careers. For anyone that would be interested in being a radiologic technologist, what is something you would want them to know or any advice you would give them?
Well, first of all, you can't go wrong with it. But you got to be able to handle gross things, right? So I hear from a lot of people, I came into this field because I couldn't do nursing. I didn't want to do the puke and the, poop and all that kind of stuff. We still deal with all of that. Yeah. Or I hear, I didn't like needles. I start IVs. It's part of it. So depending on where you're going, keep in mind, healthcare is healthcare. It's not all walkie-talkie people come in, you just take a picture of their broken, their 7-year-old's broken wrist and they walk out and everybody's happy. So you really got to be into it for all the right reasons and completely understand all of those disgusting parts of healthcare you're going to experience as well. Nice. The smells, the liquids, all of it.
I deal with all the fun stuff. And for individuals, like that's just the reality of that field and most medical fields in general, honestly.
Yes.
Also, what is something like if they're trying to get into those community college associate programs or working with the hospital to get their certification as a radiologic technologist, what advice do you have to those for the educational aspects of getting certified? Or board certified?
Be prepared to work hard. It is a rigorous program. I've got to tell you, for the 2-year program that you go through, I don't think you'll find a single person who wouldn't tell you, I should have gotten a bachelor's at the end of that program. It is a solid 2-year program. We don't get summers off. You don't get, I think we got maybe a week at the holidays, and every program is pretty much the same thing. It was a 24-month program, and it is solid. So you're in clinicals. Ironically, most programs, we do more clinical hours than nursing students do. Be prepared for that. It is a very intense program. Most of my students that I see come through, they're like, I don't know if I'm going to make it. And I just really keep encouraging them. It's worth it. This is a drop in the bucket in your time. And again, it's the most bang you can get for a buck in a career that you really love. And that, in my opinion, there's always going to be a need for. That was another thing, is I wanted job security when I was looking at things to go into. There's a lot of jobs out there that are very difficult to get into the field and very few jobs available that would be very fascinating and fun to do. But this one is one that you pretty much can find a job anywhere. You can move anywhere in the country, in the world. It's amazing.
And that's something important for people. Like maybe they are more interested in an education that requires a lot more work than it does the classroom setting, and that might be appealing to some individuals, and that might not be appealing to others. So it's important to take that into account when considering this field.
Yeah, this is very hands-on. There is a lot of book work, don't get me wrong. There are tests, there are papers, there's research, but this is a very hands-on degree, and that is very appealing to a lot of people, myself included.
And that board certification,
I'm a tactile learner.
And that board certification, everything, that's after with your program, that's run through the state, correct? And you have to get state certified?
Well, no. So it is a national, it's called ARRT. Okay. So it is a national registry, just like the nurse, just like a nurse's national registry. So we go through our program, we graduate, we are given our associates of science degree in radiologic technology. And then we go pay the hefty fee, just like the nurses and everybody else, to go sit for your board. Once you pass your board, then you become a registered radiologic technologist. just like a registered nurse. So you do have to pass that board. It is very intense, very difficult, and really speaks to all the hard work that we put into this career.
It sounds similar to like I know the NREMT is a national test you have to
Yes.
take for EMTs. Similar.
I would say more intense, more in depth. And then some states, not all states, but some states require registration with them. Honestly, your state registration is just sending them your proof that you have passed your boards and that you are nationally registered. And then you pay a fee, the state gets their money, and you get a certificate from the state saying, yeah, you check out, you can perform and radiate people within our state.
Do you find that because of that aspect that you just talked about, that you can really get a job in any state? So if that's something you're nervous about, like going, you can, as long as you're nationally certified.
As long as you're registered with, as long as you're nationally registered, it's just a matter of paying a fee and getting that state licensure. Some states take longer to vet you than others do, but it's really that simple.
Mm-hmm. On the work life, you were mentioning like all the different people you interact with. What is a typical setting for working with other colleagues also that are radiologic technologists, and how does that work?
Well, it depends on your setting. So in a lot of outpatient imaging centers, most of them work alone. There's maybe them and a front desk secretary that's checking people in, taking payment, and they're running usually a couple modalities. So they're running the CTs and the x-rays, or they're running x-rays and MRIs, or there's some that's one of those in ultrasound. Usually you're doing multiple modalities within those outpatient imaging centers, and there's very minimal staff on site. In fact, most of those sites don't even have radiologists on site. It's all remote via phone, via computer. Oh. In a hospital setting, our department specifically, so like I said, we are a very large level 1 trauma center. We have 24 CT technologists, and like 38 radiologic technologists. I'm not 100% sure of the other departments, but our overall imaging department for the hospital is close to 200 employees that support all of the modalities. So we're talking nuke med, IR, cath lab, X-ray, CT, MRI. I'm sure I'm forgetting someone, but all of those areas. So that's a lot of employees, and you have interaction with them. And really, it depends on how your hospitals are set up. It's so hard to say, oh, you're going to be working with a lot of people, or, oh, there's going to be a few of them. It really depends on where you're at. That's kind of one of the nice things about this field too. You can pick and choose. I want to be with a lot of people. At my facility, the way that we are structured and just physically set up, very rarely do you work alone. There's usually a couple colleagues in the same area vicinity with you. I've worked in other settings where for a good chunk of my shift, I'm the only one in that area, and I might talk to colleagues occasionally if I run over to the main department or whatever. It really just depends on how it's set up. I have a lot of techs recently that I've hired that have come to me from facilities where they were the only one, and one of their reasons when I asked why go from that setting to a hospital setting was that very reason. I want to be around other people in my field. I want to have interaction. I want to have interaction with the doctors. I want to be able to learn and grow and ask questions. And that's hard to do when you work alone. So, but again, that goes to show you have either option. You can work in a setting where it's very minimal, or you can work in a setting where there's quite a few of you.
Interesting. As far as you were talking about, 200 employees just roughly for that, your hospital setting, but it varies to even one person working at a time. Yeah. Do you find getting a job in this field difficult, or is it very high in demand as far as within?
So that ebbs and flows, right? And it also depends on which part of the country that you're in. Right now, radiology is in high demand. Any job in the healthcare field is in high demand right now. The last 2 years has kind of reset healthcare. So a lot of people, when COVID hit, left. We had a lot of early retirement. The nursing industry is struggling significantly right now, as well as radiology. I have been working in management now for the last several years, and not once have I worked in a department where we were fully staffed or close to fully staffed. There's always open positions. It's also because you can go anywhere, it's high turnover rate. It's very competitive. You can leave one hospital for another for different reasons: pay, the environment, your shift, the call expectations, whether you're moving on because you're moving to another area for advancement, maybe you're learning a new modality. There are so many things. I would say that generally speaking, if you're willing to go anywhere, meaning if I live in Kansas, I'm willing to move to, Vermont or whatever, you will always find a job. Now, some areas of the country are more saturated than others, which was kind of the situation I was in when I first got out of my field. I was in Middle Tennessee. There's a lot of programs around there, a lot of hospitals, and it was very saturated. It was difficult to get a full-time job when I first started. I think even there now, there's quite a few open positions because of the last couple of years. I would still say, though, as long as you're willing to go anywhere, you could always have a job.
That's important to know too, especially for someone who wants to get a stable job. Like you're talking about, that you mentioned all the benefits is why you joined the field.
Yeah.
So the next question essentially I'm going to have is going to be near the end, unless you have anything else you want to bring up about the field, but it's going to be essentially a sales pitch. Like for any, not that you need to sell it, but this is the reality of radiologic technologists and why you should do it.
That's actually the easy sales pitch to make. And I've kind of indicated all the reasons why, right? You are talking a 2-year degree. It's grueling. Don't get me wrong. It is grueling. But you're talking a 2-year degree, the biggest bang for your buck. You're going to have so many different doors open to you with that one degree. You can go into so many different facets of healthcare. You can go into the private sector. You can go into the public sector. You can go into heart, cancer, women's health, sonography. You can go into all aspects of life too. We're talking from birth to geriatrics. There is something for you to do. I think it's a field that you could never get bored in. It's not monotonous. It's not, you're just not, I know people that have been in the field for 30 plus years and they still tell me, you would not believe what I just came across last night in a trauma or whatever. So it's something that you're never going to get bored in. The competitive rates across the country, you can live anywhere, and this is needed, healthcare in general, but radiology, you can live anywhere. There are travel jobs available. You can take, 13-week assignments and go experience this part of the country, go experience another part of the country, move around. Like I said, within the field, you can, grow your knowledge. I really think you can't go wrong with radiology.
I think it's a great pitch. Honestly, I'm almost sold. I hope it helps like the listeners who are maybe didn't know what they wanted. Like, I hope this is a viable option that they will take serious consideration for. As is any medical career, everything's important. Again, we were talking about the team effort, but I hope this helps those to know more about radiology technologists and very veritable and interesting field, obviously.
I love it.
Right. So firstly, I just wanted to thank you for being and willing to do this podcast, especially for our inaugural first ever podcast for the Journey to Medicine podcast. Thank you so much, Hannah.
I feel honored. Thank you.
Yeah, I know, right? And so essentially what we're going to be doing is, for the outro, is I typically start with a motivational quote for anyone that's pre-med or anything in the healthcare field who are aspiring. And so for today, it's going to be, wherever the art of medicine is loved, there's also love for humanity. This is Hippocrates. I probably said that wrong, but
we say a lot of things wrong in the medical field, just so you know. People pronounce different things. Like that's part of the fun. That's part of the fun.
Everything, right? There's 3 names for every little drug or do something. Yeah. So essentially, it's going to be the outro. You're welcome to stay. Well, thank you all for watching all the way through. Your brilliant, bright, and beautiful minds. I hope you find this episode enlightening on the field of radiologic technologists and all the opportunities it gives in the medical profession. If you have any questions on other things we should talk about, or any questions on radiologic technologists, feel free to email us at Journey2MedicinePodcast@gmail.com. Also, please email that as well if you want to be a guest on a future episode on top of suggestions for what we should interview next in the medical field. Again, that's going to be Journey2Medicine.podcast@gmail.com. The 2 in that username is going to be the number 2. Of course, please subscribe to the podcast and share with your friends and families. As always, see you next time on the Journey Medicine Podcast. My name is Caleb. Peace.